Welcome to my page. My name is Maxilo. So I'm your tutor for today's class. So I'm going to be breaking brachial plexus into a simpler form. Like you understand it, you don't need to cram it. And if you watch my previous video, you understand that anatomy is something that you don't need to cram. So I'm going to be teaching you and I'm going to be breaking down, simplifying it, and also giving you some MCQ for you to practice on this very particular topic. So I'm going to be doing an overview of brachial plexus. I'm going to be teaching you how to draw a brachial plexus diagram without you cramming it. And I'm going to be telling you about the components. I'm going to be teaching you about the components. I'm going to give you mnemonics for you to understand. And be rest assured that at the end of this class, you will benefit from this video. All you have to do, please, is to go and subscribe. And don't forget to share this video to all your friends and all your group reading and let them benefit from this video. So let's start. What is a brachial plexus? Okay, just run down to the comment section and tell me what's a brachial plexus. You've heard about it, maybe you've read about it before, and maybe you don't really understood what it was. So I'm here to make everything simple for you. So don't fret, because everything is gonna go down today. You understand it. Okay, so what is a brachial plexus? You might define it in any way you want to do, or maybe you want to introduce it anyway. Because one thing about anatomy is that you don't have to cram anatomy. You have to understand anatomy itself. You don't have to cram it. So I'm here to make you not to cram your anatomy and make it simple. Yeah. So what's the brachial plexus? You can just think about it. A brachial plexus is a content of the axilla, and it is formed by contribution from 5 roots of the fiber, 5 roots of the fiber of what? The anterior rami. 5 roots of the fiber of the what? Anterior rami. And many people might be wondering, where is this rami? This rami is from a cervical plexus. It's from the cervical. That is where it's a division of the cervical. So that's where you can find that rami. So those roots are the things that form the brachial plexus. And the beautiful of this brachial plexus is that the diagram is so simple and you can really understand it with just this lecture. You don't have to cram it, you understand it with this lecture. So now I'm going to be telling you the components of the brachial plexus. Then we'll gradually explain the diagram. The diagram is so simplified. It's very simplified. So watch this video till the end. So what are the contents? The components. The components we are going to be talking about is 1. We are going to be talking about the roots. 2. We are going to be talking about the trunk. 3. We are going to be talking about the division. 4. We are going to be talking about the cord. And 5. We are going to be talking about the what? The branches. So let's go. So the roots. Now, I want to explain it. All you have to do is to be on the screen while I explain it. So look at what my hand is doing on the screen. And please pay clear attention, because I'll be explaining it with this diagram that is going to be showing on the screen. So the 5 roots of the brachial plexus, look at it, I'm illustrating it. It's from what? The root is from what? So the root is from C5, as you are seeing on the screen. We are going to take it slowly so that you can understand what is really going on. Then C6, C7, C8, and T1. The reason why I did it like this is because this is my hand and my pen, and I'm trying to illustrate it using a white note Then this is the line drawn downward. That line is to make a border, you understand, for this description. Now the two upper roots will form the lateral cord, which you will see later. Then the two lower roots will form a cord, and C7 will form its own cord. So in this border is a root, so the roots are there. So C5 and C6, which is the upper roots, will join together to form a trunk. Now look at the trunk. C5 and C6 will form an upper trunk. Then C7 will form a middle trunk, which you are seeing on the screen. Then the lower roots C8 and T1 will form the what? The lower trunk. So be patient while we explain it so you can understand all this video. Then all the trunk will form anterior division. All the trunk will form an anterior division and a posterior division. So you can see it on the screen. There is an anterior and a posterior division, an anterior and a posterior division for the middle trunk, and the lateral, sorry, the lower trunk will form an anterior and a posterior division. So take it slowly so that you can understand what is really going on. Then you can see it now. The upper anterior, the two upper anterior will join together. Then all the posterior will join together. You can see it, all the posterior will join together. Then the last anterior, that is the lower anterior, will form its own. It will not join with anyone, it will form its own. So the line I drew downward is to demarcate it so that it will be easily illustrated and there will be no mistake, so that everybody can comprehend it. So the upper anterior, you can see on the screen, will form a lateral cord. Look at the two anterior, the upper two anterior that were joined together will form a lateral cord, as you can see on the screen. So take it slowly. Then all the anterior will join together, all the posterior will join together to form a posterior cord, as you can see on the screen. Then the anterior will form the medial cord. So it's as simple as that, but we are going to take it slowly. Now we've done the root, the trunk, and the cord. So it's time for us to do a branch. Remember, in this video, this is a concept that I actually created for proper understanding. So this very thing I'm about to say now is not in the textbook, but it will help us to understand how to draw this diagram. All the cord, listen, this is not in a textbook, but all the cord will be divided into what? Anterior and posterior, anterior and posterior, anterior and posterior. Then the posterior of the lateral cord and the anterior division of the medial cord will join together to form a medial nerve, while the posterior cord, the anterior and posterior, the anterior part will form the radial, while the posterior will form the axillary. Then the anterior part of the lateral division of the lateral cord will form a musculocutaneous nerve, while the posterior division of the lateral cord will form an ulnar nerve, which you can see on the screen. Welcome to visual. At least you can see me now. The other one I was illustrating it using my hand and paper. So let's talk about the component, each of the component, the location of each of the components. The number one component of the brachial plexus that we mentioned earlier was the root. So where can you find the root? Location of the root. Let me use that word. The location of the root. The root is found in where? The root of the neck, behind the scalenus anterior, emerging from where? From emerging between the what? The anterior scalenus muscle and the what? The middle scalenus muscle. That is where you can find the what? Where the root of the brachial plexus is located. So if they ask in an MCQ, dash is the location of the root. At least you will be able to answer from this video. The next one is the what? The trunk. So the trunk is in the posterior triangle of the neck. When you get to that, when you get higher in this your class, you'll be taught in head and neck what is the posterior triangle of the neck. But for the purpose of this video, you can find the trunk in the what? Posterior triangle of the neck. The next thing is the division. The division. Where can you find the division? The location of the division. The division of the brachial plexus, which is a component of the brachial plexus, is located behind the clavicle of the up, behind the clavicle. The clavicle is in the upper extremities. Okay, so look at the clavicle here. There's one bone here that is that's like a S shape. That's where you can find the division. Then the cord of the brachial plexus, you will find them in what? The axilla. I'm going to do a video on the axilla for you to understand this properly and to appreciate it. But for the purpose of this class for today, it's an overview, and I want you to have a general overview on this topic. Then when you read it, you can appreciate it more and more better. So that is for all. Then please watch this video over and over again. You will get used to how to draw that stuff. It's a very simple thing. At least I was able to make it simpler. I don't know your pre understand before, but at least with this video you will understand it very more and better. There are so many clinicals attached to the brachial plexus, but I will do a video on the clinical correlation of the brachial plexus. So it's a topic I'm going to do on its own, so that it's a lot of clinical attached to it. So I will take a time to explain it. Due to the duration of the video I have right now, I will not want to extend it more. But the next video I will do the clinical on that. I will do the major clinical question they might ask you your exam on brachial plexus. I hope this video will help you to understand what is brachial plexus. At least you have a good understanding of what the brachial plexus is. Then what I want you to do for me is that after you finish watching this video, please you can turn your textbook so that when you read it you appreciate it more. There's so many branches. There's so many branches of the brachial plexus. They have a lot of branches. When I mean branches in each of those, in the root, there are so many branches. So I'll put them on the screen so I can see it, because the video is long. I won't want to elongate the video to talk about it, but I will just put a picture on the screen so that you see it and you appreciate it. Please don't forget to subscribe to this channel, and please drop a comment and like and subscribe. You're welcome. I still remain your tutor, Maxilo. See you in the next video. Thank you.